And now it's my big pleasure to announce our next presenter. And it's a great honor that Mette Kierkgaard, who is the Minister for Senior Citizens in Denmark, has joined us today. We're absolutely thrilled. And the reason we invited her is because Denmark has really interesting new reforms on long-term care that I think are really game-changing. And they do change the philosophy of care systems. So, Mette, it's all yours.
Thank you very much. And is my sound okay?
Perfect. Yeah.
Okay, perfect. Thank you. And good to see you again, Adelina. We just met a couple of weeks ago at the EU Presidency conference, which was a great pleasure. And thank you also for the invitation to speak here today, and for, of course, also the whole Global Observatory of Long-Term Care and all other parties involved in organizing this. And I've been listening for the last hour as well, and very insightful talks, and been talking a lot, and I think it's some really good insights. So thank you also all for contributions in the panel. And as you're saying, the whole theme of your conference here today is to break down stigmas surrounding seniors, and that has also been a big priority of the Danish presidency of the Council for the European Union. So I'm basically just very thrilled that so many people are engaged in this today. And as you said, Adelina, in Denmark, we just carried through a comprehensive reform of long-term care. Some of the things that will remain is that care will stay to be right-based. It will also be provided on an individual assessment, and it will also be tax-based. But apart from that, we change the whole thing. We change the steering, we change the government and governance structure, we change how we economic distribute, we change the organizing of how we organize long-term care, which change how competences are integrated, we change the whole culture also of long-term care system. And we do this more comprehensive approach, which compiles to 5 completely new legislations and 21 initiatives to support that. And we do this because we have, for decades, I would say, had like patchwork solutions that haven't really led to what we wanted politically. So let me start with that. What is actually the political goal? I mean, what is the political vision? What is it we want for long-term care? And then I'll go after that into some of the key components of the reform. And I'd like to invite you to let Michael into your mind. Michael, he's fictional, and he's probably in his 80s or 90s. Michael receives care in his home, and the caregivers visit him several times each day. They come always with predefined tasks on the schedule and a specific number of minutes to perform the tasks. And the tasks are all determined by a central assessment authority. And often the caregiver is different from the one that has been there before and the days before. The caregiver schedules are shaped by systems requirements for route optimizing and a number of all different other ideas of new public management. And they are shaped by that instead of Michael's own wishes and his own needs and habits. And actually, Michael is grateful for the help, although he finds routines a little inflexible. And he would also wish there were more space for his daily routines, habits, and he would wish that he actually knew and had good relations with the caregivers coming in him. So this picture, I hope you can get the picture, reflects the situation before the Danish reform. So that is all what we wanted to change. We wanted to change too little room for citizens' individual needs and wishes. We wanted to change that there's too little room for caregivers to deviate from the bullet points on their to-do list. And this is why we basically have launched the reform. And we have done this because long-term care in its essence is about everyday things in life, isn't it? It's about practical things, about personal care, about rehabilitation, about prevention, doing preventary issues. And all this is just things we do in our everyday life. And because it's something we do in our everyday life, it's also something that is different for everyone. So a key value in the reform is that elderly people that needs care are different people. They are diversity of needs, of wishes, of habits, and that is what the system has to and our local care system should be able to meet. And of course, there's a lot of aspects in 5 new laws and 21 initiatives, and I cannot go through all of that. But one of the things I would like to introduce to you is the key values. I think one of the basic new groundbreaking things is that the whole reform and all laws are based on a more value-based approach. And through all, like a red thread through all laws and initiatives, there are 3 governing values. First, self-determination and autonomy for the elderly, the citizen. Second value is trust in local caregivers and managers and their freedom to act and use their professional judgment. And the third value in the reform, in all aspects of the reform, is co-creation with relatives and with civil society. So let me try to elaborate a little on these 3 values. And first, self-determination to the citizen. I think one of the major achievements of the reform is the expansion of citizens' autonomy and increased focus on relational work. And just to give you an image, let's invite Michael in again. Michael has been married for many, many years, but his wife has just recently passed away. And hence some days for Michael are harder and heavier than others. And there are days where his most urgent need is for his caregiver to just sit and hold his hand while recollecting his deceased wife. And in these days, the practical needs step aside, step in the background, because human presence is more urgent right there. Before the reform, his caregiver might have actually experienced difficulties meeting that need. She might have felt, or I know she felt, a pressure to stick to the specified task on a checklist. But after the reform, she can now act differently and according to the situation she is in, because we have given her much more greater freedom to act. And we have done this because she and her colleagues are the ones that actually know the citizen best. And if we should meet the flexibility and autonomy of the elderly, we also have to give freedom to the caregivers close to the elderly. Because the caregivers' knowledge, their flexible way of handling their professional judgment is essential to meet the needs, the everyday needs of the citizen. And that is why, if I have any other heroes than elderly in my heart, it's the heroes of everyday caregivers, nurses, and so on, because they are the ones that make the difference in everyday life. And that is exactly what value number 2 is about: trust in local staff and their professional judgment. An important aspect of the reform is also what we term holistic care, or what some of the panelists were talking about is like coordinated care or integrated care. And this is a requirement, holistic care, that is a requirement in the law. And it breaks down the silos in the system. So we put holistic care as a requirement law in the law. So we actually force us by law to break down the silos. Before the reform, each service was assigned to Michael from the city hall, for instance, a bath so and so often, and stipulated so and so many minutes each time. Our or it could be house cleaning every third week, also stipulated in exact amount of minutes. But now, after the reform, we have turned this around, and to meet the requirements of holistic care, we assign a comprehensive framework of time or resources, like a pool of time, a pool of resources to each elderly. And within this framework of resources, it's now up to the staff, the personnel, and Michael together to decide what help and care Michael needs from day to day. So holistic care, coordinated care, integrated care, what we care to call it, is provided by a permanent team of caregivers that have all the relevant skills to provide the practical health care and rehabilitation. It's care workers, it's nurses, it's occupational therapists, it's physiotherapists, and so on. And the holistic care must meet, it's a requirement in the law. They must meet 4 requirements: the core value of self-determination, autonomy for the citizen. It must meet the requirement of continuity in terms of caregivers. That is, the elderly should know the people that comes by, because we know how important relational work is and relations. The third requirement of holistic care is a cross-professional approach. That is, the caregivers and the personnel should work together. Other than that, you cannot provide integrated help or be flexible in your help, because you cannot shift be flexible in shifting the care. And fourth, all care has a rehabilitation approach. So a holistic care put into the law, so we break down the silos, have to meet self-determination, continuity, cross-professional, and rehabilitation. So the third value and final value of the reform is co-creation between personnel and relatives and civil society. And again, why is this important? That is where I come from as a politician. Why is this important? And if we check again with Michael, what is actually the most important thing in a person's life? We know a lot about this. I mean, we know that giving people life, meaning, and color is it's the kids, it's family, it's maybe grandchildren and their useful pranks, which also always make Michael laugh. Maybe it's his siblings, his neighbor, maybe it's his study pal from way back, or other friends and contacts that he has met throughout his long life. And at least in Denmark, and I know this is not the case in all other countries, but in Denmark, we have for the past 80, 90 years actually failed to acknowledge the importance of those relations in our senior citizens. And up to now, we have installed more or less in the law, and thereby also over time in society, we have installed waterproof shutters between the care and all other aspects of the citizen's life. And in my eyes, this is a tragic mistake. And that is why we now let relatives and civil society back in. So with the reform, we open the shutters and welcome back their input. And we say out loud and clear to municipality administration that they must co-create with the local communities around the elderly. And just to take a point in what kind of literature we've been inspired by, it's all the literature in co-creation, and I'm sure that opens a whole image for you about what it's all about. So therefore, the Danish reform of long-term care is now just being implemented, or started here in July 1st. So we are in the implementation phase. We are putting a lot of emphasis on implementation or realization, or whatever we call it, because it's this major shift, not only in small parts of how we actually want our elderly care, long-term care system, but it entails shift in law and thereby governing, institutionalization, system, governance system, culture, competences, and organization. And of course, that just doesn't shift just overnight. So we do a lot of implementation support. If I have a little more time, I would like to say a little, Adelina, on what we are also occupied with in Denmark, namely that senior citizens are not only limited to those that receive health and care, or to long-term care. At least in Denmark, that has been the only thing elderly policy and senior policies has been about, long-term care system. But some of you also in the panel talked about a more broader perspective on elderly and senior politics, and that is what we are trying to dive into now, namely that policies is also about all seniors, including also in Denmark at least the 86% of seniors that does not receive any long-term care. And that is important, of course, because we are so lucky that we grow older, we live more, longer, healthy lives. I mean, what a joy, isn't it? Basically, I mean, imagine the opposite. But it also means that our society is in a dramatic change, because just to take the Danish numbers, within 10, 15 years time, we will be a fourth of the population is 67 years of age or older, and in the countryside it's about 30-40%. So that means a whole different society, both in the municipalities and nationally. And when we are changing so drastically, we have now asked ourselves, how can we make our country more age friendly? So we have set up a work about age-friendly society, which has to do with how are we going to live, how are we going to work. Some of you touched upon the labor situation. How are we going to transport ourselves when we have also a big percentage of urbanization and all transport systems are closing down in the rural areas? But how are we then ensuring mobility when we also see older generations in the countryside? How are we going to design our urban spaces? At least in Denmark, for the urban spaces has roughly been designed 40, 50 years ago, but that was a whole different society. Should we make more common spaces? Should we have more benches because we have to sit down and rest? And how should we actually design our urban spaces? What about our housing? How should we have our housing in Denmark? 60% of 80 plus years of age are living in their own houses that they own, and often they are way too big because they've been living there with their families, and we don't have the right kind of housing capacity. And basically, it's just a great potential, because not only does it give us a lot of challenges, but what we also know is that we are faced with a pretty high level of age discrimination. Actually, in Denmark, perceived age discrimination has risen since 2019, so somehow our narrative and our thinking about ageism or seniors in our societies has been this thing about seniors being dependent. I believe one of the panelists were also talking about that. In the welfare system has, so to speak, succeeded way too much. So now we have seniors that are seen as a group of being dependent people that needs care. But when you see what they do instead, they are occupied, they want to work more, they are volunteer people and so on. So therefore, there's also a whole potential that we have to release. So therefore, we now rethink our senior policies in large, and we do that in terms of urban spaces, transportation, mobility, housing, workplaces, digital inclusion, social inclusion, because loneliness is also getting a bigger problem, and so on. And the first thing we do is we just did that 3 weeks ago, just after we met actually at Adelina, that we have established a council of 15 very clever people from a wide variety of sectors in life or in society. And they have 2 jobs. They should formulate a vision. And this is at a government level. It's not only me as a minister of senior citizens, but we have it. It's decided at a government level, which I'm very pleased, because sometimes it's easier if your bosses also know what you're doing. So it's based in the Ministry of Senior Citizens, but it's a government that asks for a vision. So this council should make an outline of a vision for age-friendly Denmark. They have until May to do that. That's the first job. And when we have that vision, we take it back in the government and say, how should we work on a strategy for age-friendly society? And the second thing the council is doing, and now I'm closing up. The second thing the council is doing is to make a popular movement, because we cannot, I believe, make a age-friendly society just sitting in our government offices or in councils. We have to engage all society. So we do that in a number of ways. One of them is to make an alliance that should also give input to the council, where right now we have like 80 organizations, like architects funds, 80 organizations, and it's just like an open alliance that everyone who wants to join, talking about, contributing to, coming up with ideas about what an age-friendly society or Denmark should look like, are invited, and the council use their contributions, because I believe this is also a culture shift. And when we want to have an age-friendly society, we have to do that. And finally, I want to say, of course, we have not invented this. We are very inspired by the work done by the UN, by WHO, by OECD, talking about age-friendly societies. I think also some countries very inspired by Norway, and also very, very inspired by Ireland, whom I guess are some of the frontier first mover countries. But we try to say we want to join that, right? And that's what we are going to. I think that was what I wanted to say, Adelina. So over and out. Thank you.
That was fantastic. Thank you so much, Mette, and really, really inspiring. And from the observatory, we want to be following very closely the implementation of the reforms, and also maybe help spread the word on this vision for an age-friendly Denmark, and also a complete change on how we're looking at care, and taking this really holistic approach, and moving away from the tailorization of tasks, and making the system for the system rather than for the people. And I wanted to ask you a question. So this is all happening in a context of big shortages on workforce, and this is a shared challenge that we have already heard about earlier today across countries. And I would like to hear a bit more about how you see that maybe this reform might be helping with this.
Yes, thank you. And I completely agree that if we should succeed, when we succeed, about the mindset, right? With the reform, we have to have enough workforce. I mean, in Denmark, like in a lot of other countries, that is one of our big challenges. I think it's like a bouquet of flowers, and the things we have to do to ensure workforce. One of the flowers in the bouquet is the reform, because at least in a Danish context, we have the level of illness and the level of leaving your job to find another one is way too hard in long-term, or high in long-term care, much higher than in other areas. And my belief is that it's because we have been working in conditions and under regulations that does not meet up to having meaningful work life. I've been working a lot with leadership. I'm fairly new in politics. I've been working a lot with motivation. When are you happy in your life, and so on. And there's a lot of research about that, and we have tried to put that into the reform as well, because when working holistically, we can fill up at least 3 dimensions, which we know are very important for happiness in work. We can have more autonomy and space to use your professional judgment. We know that's important. We know that working together in teams and having colleagues to discuss with is important. That's exactly what we create in holistic care, and also to have the competences. And that is why as part of the we don't want to do a job we don't have the qualifications and competences for. And now we give people more space, and or they should use their competences just following a scheme. And also we have a lot of education as part of supporting the implementation. So I hope and know some of the piloting we have been doing for the last couple of years shows that it's easier to attract people to the workforce in long-term care when you work like this. And you also see that the level of sickness is much lower and people stay in their jobs. So one thing I hope, and we have, as I mentioned, some pilots that shows that we're pretty confident that we will have that effect. I think we also need to work with welfare technology. Actually, in a couple of weeks, we'll launch a national strategy of welfare technology, not with two aims. One is to make life more autonomous and worthy for the elderly, but also only in talking, the strategy is also aimed at reducing labor time spent in, not because they should spend the time on things that where relational work and their human competences are needed. So welfare technology, and we have a national strategy also as part of the reform coming here in 2 weeks' time. We also have actually also within the next month, if everything goes fine, I'll go and sign in India and the Philippines. We've been working for 2 years now for partnerships for international labor, where we have made some really, really good partnerships with India and the Philippines to educate care workers in India and the Philippines, and then to integrate them into the Danish workforce. Very inspired by Germany. I'm going to London actually Tuesday, where we also have to listen to their experiences and so on. So I think make good workplaces. Number one, I would say, so for have it attractive. Welfare technology, international labor, and then we have also made a age reform in Denmark, where we have targeted more wage to this group, and we also made some changes in our education. So I think it's a bouquet if we want to succeed in workforce.
Oh, thank you. And I think I'm going to end by going back to the previous panel. So what's the importance you attach to investing in long-term care? You're obviously very motivated, but you're also needing to persuade other government departments, I guess.
Yes, I think actually in Denmark we have a very a good cooperation between ministries, but I think, as you say, it's a prerequisite to have that. I think our luck in Denmark is that I think this current government, and we are just now going into our fourth year, we have been making reforms in lots of areas, in health sector, in the elderly sector, in the education system, in tax system, and so on. And because we have all of them has had more, because some of the things we're doing in the elderly reform, the mindset changing is some of the same things we see in reform of school, reform of healthcare, and so on. And also because, as some of the panelists also were talking about, the coordination and collaboration and integration between the health system and the elderly care system is so important. And because we have had a reform also in the healthcare system, these things go hand in hand. So I think that has just been our luck, that we have not been sitting with someone saying, oh, we just have a reform, we're just 2 years in implementation, but we're doing it at the same time. And I think it's what has also been easy with the elderly reform or long-term care reform is that there's been the consequences of the current system is so visible. We simply need to do something. So politically, everyone knows that we need to do something. And one advice I could get is, I hope all other politicians don't just introduce long-term care only in the healthcare reform, because long-term care is about living lives. It's about, of course, elderly people are also often sick, right? That's multi-sick and so on. But we are first of all human beings. having relations and where presence, I know Ton is coming. I mean, he would say, presence, stop, and be interacting with people and so on, which is it's a whole different thing than the health regime. So I think that's also because it has been so meaningful. Maybe it's easier. Yeah, I don't know if that was a very precise answer, Adelina.
I think it was a really helpful answer, and you're showing us the importance of two things. I'd say on one, the fact that the whole of government is thinking of changing, but also I think the drive and the enthusiasm and the passion that you're bringing. I think you must make it very difficult for others not to go with you on this journey. So I'd like to thank you so much for this contribution
for the invitation.
Explaining this to us. So please join me in thanking Mette Kierkgaard, and thank you for taking the time to
my
be with
pleasure.
us today. Thank you.
Thank you. And,